Thank you for your time, Dr. Jega. Can you share your experience using Motiva implants?
So we are using the Motiva implants since 2015, so we have over 10 years of experience with them. And what we appreciate with them is the softness. They have a very low rate of capsular contracture, less than 1%, very low rate of rupture, less than 1%. And we did a shift from a submuscular to a subglandular pocket, and patients really appreciate it because we don't have to destroy the muscles, we don't harm the vessels, the lymphatics, and this is something that our patients more and more appreciate because they have a faster recovery, less pain, and can return to the daily activities immediately.
So, what are the bad aspects of submuscular pocket?
I would say the bad aspects are it's painful, it's a longer recovery, you destroy the muscle partially, you can have muscle animation over time, which does a distortion of the breast. And this is something that especially sporty patients don't like a lot.
So, you mentioned about hydrodissection while you're during the surgeries. What are the benefits of hydrodissection?
So hydrodissection is essentially allowing us to use fluid in order to create a pocket. So it gently pushes essentially the tissues aside. And in this fluid is also adrenaline and local anesthesia. And the advantage is that it also does hemostasis, so we have much less bleeding. So it's a very gentle way of creating a safe pocket for my implant.
So we gave a lot of presentation and also enjoyed your lectures. So overall, how was it for my lecture?
I really loved the experience being here. I really loved your lectures. You have excessive experience with a lot of implants. And all the time when I'm in these international conferences, I learn a bit from each surgeon that is coming and presenting. And this is what I really appreciate about these international societies. As well as in Europe, we never see Asian surgeons. So it was really an honor to see a famous surgeon like you doing your surgery and sharing your experience with us.
I was very honored too. I saw a lot of your paperworks and also your video clips that was posted by Dr. Charles 랭퀴스트. Can you give us your clinic introduction?
So our clinic is Victoria Kliniken. It's a clinic that is 25 years in Stockholm, Sweden. And what we really like to do, or what is special about us, is that we essentially do a lot of patient data collection. So we see our patients with ultrasound after surgery at 6 months, 2 years, 4 years, 6 years, 8 years, and 10 years after surgery. So we have a massive data collection and we really know how the implants behave over time, what is our complication rate, and so we can really work on lowering it and making a better and safer surgery for our patients.
So you're using MIA and Preserve. So why is tissue preservation is important for women's health?
I think it is very important because, first of all, busy women of today, they usually work, they have children, they're very sporty, they're socially active. They don't want to be home with a sick leave. They want to go immediately back to work, immediately back to their beloved ones. They don't want to have a lot of pain. And tissue preservation means that we keep the nerves, the muscles, the vessels intact without disrupting them. And if we can give this to our patients, then I think it's a beautiful add-on to their life quality and to not destroying the tissues over time.
I think it's the future, less damage to the soft tissue and giving their better experience with the surgery. So any remarks for the women who are going to have surgeries?
I would really look for a surgeon that is up to date, that travels around, that refines his technique like you, who is trying to get better over time, who follows up his patients over time, learning from his own mistakes, who is a board-certified plastic surgeon, part of the international societies, because then you can be sure that he will deliver you with the most recent technologically advances.
Thank you for your time and thank you for your insights.
Thank you very much.